evening, sir.
Yes, go ahead.
Have you had breakfast?
Doctor asking me about breakfast? Or have you become my mother or my wife?
No, I'm just your anesthetist.
So what has anesthetist got to do with my breakfast?
This is Ugonna Chukwumaife. This episode will be looking at the intra-op phase of the perioperative period. And I'll be making references to the sleep factory tour we had last episode. But before that, your anesthetist needs to know a few things about you before he or she lays a finger on you. First is your previous anesthetic experience. What was it like? Did you wake up as quickly as expected? Were there any reactions? And not just yours, but your close family relatives. The reason being that some anesthetic related problems can actually be genetic. What medications are you on? I am aware that some doctors give their patients medications without telling them the names of the drugs they're giving them or what the drugs are meant to be doing. Some people are allergic to medications and that is quite dangerous. So please, if you're going to have any surgery, ensure that you know the names of the medications you are on because we like to know. As you saw during the tour, we use a variety of drugs while you're under anesthesia. Some of our drugs might actually inhibit the effect of the ones you're taking or interact with them to cause problems. So we need to know to adjust our technique. And we don't want you having an allergic reaction when you're under anesthesia because we've given you a drug you shouldn't have. Next is we look a bit into your social life. How much alcohol do you consume? Do you take recreational medications? I know this may be secrets, but we like to know. It helps us tailor our anesthetics. And believe me, we won't divulge that to anybody. And then, have you had breakfast? Or lunch, as the case may be. We don't want you coming for anesthesia with a stomach filled with food. The reason being that once you go to sleep, you could vomit and then the food goes into your lungs. This can be catastrophic. So we advise that you fast for at least 6 hours from any kind of food, milk, and then for an hour or two for water and plain drinks. Now you also have some responsibilities. You want to make sure that that surgery is right for you. You want to make sure that that surgery is for you. There have been cases of misplaced identity, wrong surgeries. Wrong site, wrong sites. Please make sure the surgical site is marked and the site is noted. We also want to know, we don't want to give you a regional anesthesia on your right hand when you're having a surgery on your left. Again, there are some times when you consent for a particular surgery and during the surgical procedure there is a complication or the surgeons find out something, and in that consent you're actually made to understand that they will do everything they have to do to treat, and if there's a complication they will go to whatever extent to treat that complication. Some people have woken up from anesthesia and even gone home without knowing the extent of the surgery they had, and later in life that's when they're discovering it. I'll tell you a story. We once had a patient who was being treated and investigated for subfertility. She didn't know that some surgery she had in the past, she had a womb taken out. That was found out during the investigation. So such things can really be worrying. Call your surgeon after the effects of anesthesia have cleared, and then ask, what exactly did you do? To what extent was this surgery? Responsible surgeons should offer this conversation, but just in case it doesn't happen, please ask for it. Now, let's start this intra-op phase. When you walk into that sleep factory, which is our anesthetic room where we make sleep, we will first of all connect you up to our screen and we take your vital parameters. This includes your blood pressure, your heart rate, how much oxygen you're getting, your temperature, and we like to look at the rhythm of your heart as well. These are the basic. Now, depending on the circumstance, which is your underlying medical condition or the surgery you're having, there may be other parameters we'll like to look at, but I wouldn't go into all that. And now we will get a cannula at the back of your hands for giving you medications, infusions, fluids while you're asleep, and that is where we give you the sleeping injection. And we also give you some oxygen using the face mask, which you saw. And then we put you off to sleep. When you've gone off to sleep, we will get a tube down your windpipe. This goes into your lungs. We connect that tube to the breathing circuit, which I showed you, which is connected to the anesthetic machine and the ventilator. This keeps you asleep. This breathes for you. This gives you oxygen. Sometimes we need to relax your muscles to be able to get that tube in. Now, once we are happy that you're off to sleep and you're well asleep, we will then wheel you into the operating theater room. Now, the logistic arrangement is not exactly the same in every hospital. So some hospitals will not use the anesthetic room. Some circumstances you may not start in the anesthetic room. You will start in the operating room. Now, during the surgery, we keep monitoring your vital parameters. You saw the screen with the numbers. We try to keep you warm because when you're under anesthesia, your temperature regulating system is not working at its best. And then the temperature of the room is cool. So that machine is connected to a blanket that we place over you. It blows hot air and that keeps you warm. Okay. We make sure that, you're pain-free, and if we need your muscles relaxing, you're relaxed. So our job as the anesthetist is to look after you and to enable the surgeons to do a good job. Now, the surgeons concentrate on what they are doing and they don't know what else is going on. If your heart stops, we hear stories of people having cardiac arrest while they're having surgery. It's the anesthetist who will even notice that your heart has stopped and, start to resuscitate you. Now, after the surgery, once the surgeons are happy, they've cleaned up, they've closed up the wound site, they've put their dressing, and they're happy for us to start waking you up. We'll turn off our gases, we will reverse the medications that need reversing, and then we let those medications clear from your system. And then once we are happy that you're awake, you're breathing, you're coughing, and you can take control of yourself, then we will wake you up and take that tube out, and you're free. Sometimes you're not able to wake up immediately after the surgery, or for some reasons we don't want to wake you up. We'll keep you asleep and take you to a place where you'll be looked after until it's possible for you to wake up. Assuming you wake up, which is the case most times, you'll be taken to a recovery area where the nurses will look after you until you're well and we are sure that there are no immediate complications. Now, I would like to end with this. You know somebody who loves you because the person wants to know when last you ate, and that person will always look at you and admire you the times you sleep. So in addition to your mom, your spouse, or your partner, your anesthetist is one of the people who also loves you and cares for you. Ensure you keep in touch on our Facebook page, Instagram, YouTube channel. Leave your experiences with us. Our next episode, we'll be talking about how you can enhance your recovery after surgery and anesthesia. Thank you.